I must commend you to sit here in a room and talk about these issues, things that normal Canadians honestly probably don't give a lot of thought to. We appreciate it as normal Canadians. I appreciate your dedication to this. I would caution against prescribing values to people you disagree with. I find that that is always corrosive to dialogue. It pits people against each other rather than actually talking about the issues, which I think is one of the goals of this conference. So just wanted to point that out. Now, I may not be a pharmaceutical expert, but in my work with the Canadian Taxpayers Federation, I am an expert, unfortunately, in exposing government waste, in battling bureaucracy, and in holding elected leaders in Ottawa and Victoria to account. We've been fighting this fight for almost 25 years on behalf of taxpayers. We've saved Canadians literally billions of dollars through our advocacy work. We are certified government waste busters. We've seen government programs, especially at the federal level, spiral out of control again and again, and that's why we believe very strongly there should not be a national Pharmacare program. Now, I know this flies in the face of a lot of what's been said here, but the federal government of any political stripe, including the current one, has proven itself incapable of managing programs efficiently and effectively. I'm going to run you through 3 quick examples, recent examples. Back in the 1990s, the federal government decided Canada needed a long gun registry. The cost to taxpayers was going to be $2 million. $1.2 billion later, they finally scrapped it. The MP pension plan was calculated by politicians as costing you and I $6 for every dollar that a politician put in. The actual total before it was reformed this year was $23 for every one we put in. That's $250 million. The F-35 fighter jets were supposed to cost Canadian taxpayers $9 billion. Before the program was suspended for a review, the independent budget office estimated the true cost at $45 billion. Nothing gets cheaper when you give it to the federal government. So forgive us if we don't join the rush to create a national Pharmacare program. We've just seen this movie too many times before to really get on board. We believe the best path forward for both Pharmacare and taxpayers is to remain in the hands of the provinces. Generally, the best government is the government closest to the people, with more participation by the private sector. Roughly 3 in 5 Canadians are covered to some extent by a private drug plan. You guys know these stats better than I do. This is why governments pay roughly half of all prescription drug costs, while private insurers pay another third or so. Obviously, not everything, not everyone is covered, but the basic model is there, and it can work. So how do we increase the number of people obtaining private insurance and help level off the cost to the taxpayers? Well, there's a number of ways. Payroll taxes are one of them. The biggest hurdle in British Columbia is that many employers are already paying huge medical service premiums, healthcare taxes, on behalf of their employees. This MSP tax in British Columbia has increased 6 times in 5 years, jumping from $108 a month for a family like mine in 2009 to $138.50 next January. That's a $366 annual increase, 28% over 5 years. In fact, this tax has doubled since 2002. Now, imagine the cost of this payroll tax stretching across an entire division of a company or a company itself. It's not hard to see why employers try to whittle down other healthcare costs, such as drug plans. There's just too much money going out the door already on healthcare in their minds. And I should note, BC isn't alone in nibbling away the ability of employers to provide benefits. Pharmacare advocates should be very concerned at how federal employment insurance and Canada Pension Plan payroll taxes continue to grow at an unsustainable rate. If you make $50,000 a year, your employer pays $3,600 just for the privilege of having you work for them. That's on top of all of their other corporate taxes that they pay. You pay $3,200 just for the privilege of having that job. That means less money for drug plans, puts more stress on taxpayers, and it means less jobs. Frankly, we prefer the Fraser Institute's model for Pharmacare, that governments create policies to encourage a competitive private sector insurance market in which universal access to drug insurance is facilitated through means-tested subsidies. We think this would give sick people access to new drugs far faster than we presently see in Canada. Patients getting faster access to medicine in turn saves taxpayers money in expensive treatments. Now, I heard the chuckles there. To many public sector employees, relying on private drug plans is synonymous with throwing vulnerable people to the free enterprise wolves. That's where it's fair and prudent for government to come in with subsidies based on actual proven need. People who, through no fault of their own, can't afford the drug plans the market provides. That's a lesson we learned in BC. We're switching our government Pharmacare program over to need-based eligibility, save taxpayers 17%, while still taking care of seniors, lower-income residents. This experience actually highlights another reason to continue provincial management of Pharmacare. There is more opportunity to experiment, try other ways of delivering service. Nationalizing drug distribution will kill flexibility. Take Pharmacare national, and I guarantee you at your 2030 conference, you can bet you'll be talking about what's wrong with Canadian Pharmacare, or, man, the Fed sure messed this up. When it comes to government, bigger is not better. Thank you.